Executive Director of the National Institute of Health, Dr. Amr Ikram. Ladies and gentlemen, Assalamu alaikum. Good afternoon. We're here today to celebrate our partnership in combating COVID-19 today by providing to the Ministry of Health these mobile laboratories. And I want to congratulate Minister Patel and the Pakistani government, the National Command and Operations Center, the National Institutes of Health, and especially the frontline health workers for their successful vaccination campaign amid enormous challenges. The doctors, the nurses, the technicians on the front line of combating this pandemic are the real heroes of our time, and it's really our honor to support them in any way we can. The U.S. government has worked side by side with public health officials in Pakistan for more than 6 decades. This partnership has helped strengthen Pakistan's healthcare system by creating infrastructure, training staff, and developing emergency action plans. Our joint efforts to combat COVID-19 has been a model of cooperation, and we intend to build on this effort. The United States is the single largest donor of COVID-19 vaccines to Pakistan, 61 million doses since June of 2020. And we've donated nearly $80 million in COVID-related support to Pakistan, including rapid diagnostic tests, protective equipment, hospital equipment. And these donations, combined with the hard work of Pakistan's dedicated health workers, scientists, and government officials, have saved lives. Throughout the pandemic, reaching rural communities was one of the toughest challenges. Isolated populations without access to high-quality health care are especially vulnerable, and public health officials struggled to reach them with testing, treatment, and vaccinations. That's why I'm pleased to hand over 4 mobile laboratories to the National Institute of Health. These mobile laboratories contain state-of-the-art diagnostic equipment and technology. They'll improve the accuracy of diagnoses and dramatically reduce turnaround times for testing results from days to hours. The pandemic reminded us that while we might all want to be done with the COVID pandemic, COVID is not yet done with us. Today we're seeing spikes in COVID-19 infections around the world, and we must remain vigilant in protecting ourselves and our communities. I'm confident that Minister Patel and his team will use these mobile laboratories to protect the people of Pakistan from the resurgence of the COVID-19 pandemic. Our cooperation to combat COVID-19 is not the first time we've worked together to promote the health and well-being of the Pakistani people. During the 75-year partnership between Pakistan and the United States, we've helped Pakistan expand access to clean drinking water and sanitation services, respond to other infectious diseases such as typhoid fever, and improve the quality of healthcare products available to Pakistani communities. And that commitment continues as we prepare to hold the first U.S.-Pakistan health dialogue in Washington later this month. This initiative will seek to deepen ties between the U.S. and Pakistani healthcare sectors and identify opportunities for further work together. Today's donation of the mobile labs is the latest example of our shared commitment to improve the health of the Pakistani people. And I hope it also serves as a sign of the enduring friendship between our two countries.